Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, and welcome back to another episode of Straight Outta Health IT. I am so excited to have on the program a woman who has just been one of my favorite individuals. I've been following her for quite some time. And when I started the podcast, actually, I made a list of the people I wanted to have as guests, and she was like number one. So I'm just so glad to have finally found time in her crazy schedule to have her on the program and to talk about a wealth of topics that she's very passionate about. So without further ado, let me introduce you to Dr. Kameron Leigh Matthews, who currently serves as Chief Health Officer for Cityblock Health. So who is this dynamic, change agent in our industry? Well, let me share a little bit of her bio. Dr. Kameron Leigh Matthews is the Chief Health Officer of Cityblock Health, a transformative value-based healthcare provider integrating medical, behavioral, and social services for Medicaid and duality-eligible and low-income Medicare beneficiaries. A board-certified family physician, Dr. Matthews has focused her career on underserved and vulnerable communities, having held multiple leadership roles in correctional medicine, federally qualified health centers, and managed care. Most recently, at the Veterans Health Administration, she led transformational efforts focused on integrating veteran-centered models of care, including the implementation of Mission Act of 2018 and the EHR modernization effort. She's a member of the National Academy of Medicine, in addition to other nonprofit and advisory board positions. She serves as vice chair of the board of directors of the National Quality Forum. As a passion outside of work, she co-founded and co-directed the Tour for Diversity in Medicine, an innovative seeking to bring premedical enrichment activities to underrepresented minority high school and undergraduate students across the country. Wow. What an amazing career, and what amazing individual who is leading the transformational efforts within this industry. And so, Dr. Matthews, thank you for joining our program today.
Thank you, Christopher. I'm always a bit blushing as you read my bio. So thank you.
Well, I tell you what.
I can't believe I've done that much.
You've done a lot in a very short period of time because you're probably like 12. So it's amazing that someone so young has done so much in such a short period of time. And we're just so thankful for your leadership in supporting everything you've done for our veterans and the underserved communities as well. And the first question I always like to lead off with, Dr. Matthews, is I read your bio. But that doesn't tell us your story, right? It just tells us kind of your high-level accomplishments. There's a story behind everything you've done. And so I want to give you a few minutes. Yeah, exactly. So I want to give you a few minutes to just do just that. Talk about your journey. Share with us what got you into to medicine, and tell us a little bit about the journey that's led you to the different roles that you've taken thus far.
Oh, of course. So I'll be very blunt. As many students, with the work that I do, as many students as I try to reach, I never like to tell my story because I'm the one story that I feel like isn't necessarily that inspiring in the sense that I am a proud second generation physician. My father
that's
is a story physician as well.
Yeah, that's a story.
It's a story. No, his story. No, I love to tell his story. It's not my story,
let's hear it.
But it's my story by extension. Yeah. No, he was the first in his family to get his 4-year degree. We had a family of teachers, as so many of us are. Many of my cousins are teachers. It's lovely, but my dad really stepped away and actually left DC. He's from Northeast DC, where I live now. I love how surreal that is. He moved up to Philadelphia and went to Drexel for his engineering degree, electrical engineering. He was with the Philadelphia Electric Company upon graduation, climbing poles and fixing wires.
Wow.
And decided he wanted to do something more people focused. He went back to night school and got into medical school. He was one of 6 Black people in his class. He eventually, with his family medicine training, got up to be the first and only department chair of family medicine at the hospital, where he then practiced his whole career, where my sister and I were born.
Oh, wow.
My dad is a leader. He still sits on the board of trustees of the hospital. I have always looked up to him, his ability to lead, to really manage and be a strong voice as a Black man. I just always really appreciated his position in not being afraid to stand out.
Absolutely. And being a hero, right?
And my hero. That is the best way to describe it. That is the best way to describe it. So my goal when I was growing up, to be bluntly honest, was all I wanted to do. I mean, trust me, I wanted to see patients. Don't get me wrong. I wanted to help people. But I wanted to walk into a room and someone say, Dr. Matthews, and both of us say, yes.
That's great.
And
that's great.
It happens all the time. It happens all the time.
That's wonderful. It's so funny you mentioned that, because I grew up in a family of educators as well, too. My grandmother was a teacher and a principal, and my dad was a teacher and an entrepreneur, and my sister's a teacher. I never thought I would go into teaching, but actually I serve as an adjunct for a few universities as well, too. And so I guess it's in my DNA. And my dad was my hero as well, too. I remember how he inspired me so much to have a passion for education and learning and being the best you can be, despite all the potential obstacles that might have been in front of us. So sounds like your dad was a very similar type of individual.
My goodness, yes.
Yes, exactly.
Exactly. My goodness, yes. I think this is where I recognize the importance of mentoring comes into play, right? So he was a role model, a hero, but as a mentor, really continues to help guide me. Although he completely says, you're way past me now. I don't know why you keep asking me questions.
Well, he laid the groundwork for where you are today. So I commend him. And thank you, Mr. Matthews, for raising an amazing woman and leader. She's making a difference in our community as well.
I really appreciate that. That. Yeah.
So an amazing career, from correctional medicine to federally qualified health centers to the VA, now to your new role at Cityblock Health. You've had, an interesting journey. And I want to make sure you get an opportunity to really talk about what you're doing today, but share a little bit about that journey as well, too.
Yeah. So I made a very different decision, again, from my father. Wanted to go into medicine, wanted to be a family doc. That was never a question. I believed in primary care, the strength of primary care. But I wanted to treat a different set of communities. I wanted to not necessarily be just in a small private practice. I wanted to go bigger. I knew I needed to help communities. I needed to solve problems at a different level. So it was just a difference I noticed earlier. So that actually equated to me stepping away from my medical training and going to law school. So I actually did law school in between 3rd and 4th year of medical school.
Okay.
And wanted to become an advocate.
That's not in your bio.
The system in which it's not in my bio.
No.
Yeah.
That needs to be in your bio. But no, I'm sorry, I didn't mean to interrupt you. Go ahead.
That's so funny. I guess I never even thought about it. But I need to be able to advocate. I need to understand the systems and the structures in which this thing called healthcare is built, right? And how it serves or does not serve the people that we hope to help. So law school for me has made me a better clinician. It's made me a better leader. So it was a nice opportunity then during my residency training, that was after law school, returning into healthcare, where I got an offer to explore at Cook County Jail here on the west side of Chicago. And they made me, after a month of being there in training, they made me an offer for a permanent position. And so I jumped there, and I've never felt more fulfilled.
Exactly.
Never.
Right.
I have never felt that I was actually making an impact more than treating a population of mainly men, because I didn't do what a lot of other women did and just treat the women. I was on the men's divisions. I never felt.
And that's it. Yeah, and that's interesting because men typically shy away from, African American men in particular, typically shy away from wanting to get health services unless they're really, really sick or forced to go by their loved one. So it's interesting.
So guess what? I had them all in there with me.
Right, exactly.
I hate to say that, but yeah, no, 95, 96, 97% of my patients were Black and brown.
That's great.
I also led our transgender health committee. A very unfortunate disproportion of transgender individuals do interact with the justice system. So I was able to be their primary care doc. I was able to advocate for them and actually ran our committee in which we made decisions about their security, not just their healthcare.
Absolutely.
So that was kind of like my first step into like that policy work. I was like, oh, I'm a young doc. I'm a young lawyer. I can do this.
Right.
And so moved on to community health centers, also formal name, federally qualified health centers, again, on the south and west sides of Chicago, really trying to understand how can we think about these underserved communities. So it's not just a single patient at a time, not just a family at a time, but how are we thinking about what resources are available and everything that impacts healthcare and well-being, which are now, of course, called social determinants of health, right?
I was going to
recognize your income, your education, your zip code directly affects your outcomes, right? And that's what federally qualified health centers are so good at. Yeah,
absolutely. I was going to say you're on the front line of seeing the impact of social determinants of health with a specific community that's impacted by that as well too. And I was just curious also, what having a physician of color being in that community, did you see a unique impact of on the community as a result of that?
I think so. I think so. I think the number one component of a relationship that a physician can have with a patient is trust.
Right.
They need to be interested in and committed to engaging with us, right? I mean, it doesn't work. It's not a one-sided thing. Yes, maybe at some point medicine was very paternalistic and everybody just listened to what we said, but that shouldn't be the case. Definitely not with the communities that we're serving. They need to trust the individuals that are there supposedly advocating on their behalf. So the number of families that definitely responded positively when they walked in the room and saw me, or the older ladies that just were so proud, clearly, as I was helping take care of them and their daughters and their sons. I think I definitely made a difference because I was able to connect with them in a very different way. And that's where that sense of that's where that importance of diversity and of identity within the healthcare workforce comes from. It's not just the feel-good argument that we need more Black and brown docs. We need more Black and brown docs to actually help patients. It's been shown time and time again, study after study. This is not just because we want to have an equality argument for the workforce. It's an equity argument for our patients.
Absolutely. And it's so funny you mentioned. I was reading some statistics in preparation for this interview, and I ran across something from the Association of American Colleges. It says the percentage of percentage of physicians by race and ethnicity amongst active physicians, 56.2% identifies white, 17.1% identifies Asian, 5.8% as Hispanic, and 5% as Black or African American, and the other 13% is kind of unknown or other. And so clearly, there's an underrepresented number of physicians of color, especially in those underserved communities. So why do you think, we still struggle, it's 2022 going almost into 2023, and we still don't have the pipeline of healthcare professionals, specifically doctors of color represented based on the overall U.S. population? What's the challenge here?
I mean, I think that unfortunately the answer is the same exact reasoning behind why we still have healthcare disparities for our patients, right? The workforce isn't diverse because it's not prioritized. Solutions aren't prioritized. Resources aren't dedicated. Recruitment and everything else upstream, making sure that our schools have the science and the level of rigor and test-taking skills offered for students so that they can really enter this marathon path into medicine. It's not there. And the rest of healthcare as well, too. It's not even just medicine. It's nursing, it's pharmacy, it's dentistry, it's everything. It's the same as I think. There are social determinants. I like it, this is not my quote. I love this phrase that I see in articles coming up now. Just as much as there's social determinants of health, there's social determinants of education.
Oh wow!
And if we aren't putting resources into our students to then join this workforce, if we aren't addressing the institutional and structural racism that is keeping them away from entering this workforce, then we're always going to have the same outcome. It's the same exact thing for our patients. If we aren't addressing the larger social needs, the income, the education, the lack of clean air, the lack of clean water, everything that we're seeing in these communities around the country, you're never going to improve their health.
Absolutely.
And there's also the institutional racism, the structural racism that's also going to keep them there as well, too.
Exactly. That's interesting, that term, social determinants of education. There's another one that I always often quote called the political determinants of health, right? And that's how the legislation and laws have an impact on the quality of care in various communities as well, too.
Yeah, and I love that Daniel Dawes book. I absolutely love that book, and I completely agree. You know, me being a little mini politician that I am, and we can get into that whole thing at the VA, how I got really involved even more. But the concept of political determinants of health is one of the reasons why, you know, particularly at Cityblock, and it's not just us, there's other organizations, particularly one called Vote ER, really thinks of voting access as a social determinant of health. Sure. If you don't have access to actually interacting with your political structure, that has an impact on your health outcomes because you don't have a voice in how the laws and the policies and the resources are being directed to improve your healthcare. Exactly. So we are actually seeking to enroll, you know, members in voting polls in our different markets, and like we're launching this whole effort actually in partnership with Vote ER for this exact reason.
So expound on that. Talk a little bit more about Cityblock. Well, I mean, you obviously left a very prestigious role with the VA. You know, you were, shaking up things there, launching the whole digital transformation around electronic health record and leading that effort, which is still ongoing. And you decided to switch gears midstream and join this organization. What prompted that, and what did Cityblock do to court you away? And what are you guys doing to transform how healthcare is delivered in those communities?
I love it. I look at this opportunity with Cityblock as a dream come true. It's what I've been being prepared to take on through my other roles. In each of the spaces that you described that I've kind of been through, I learned something new, whether it was operational or strategic, that I could then apply in this transformational space, right? So the VA, for instance, to me, we discuss value-based care, but it's really also about a clinical care model that is about the whole person and making sure that there are no gaps in care, that you have responsibility and accountability for every moment of that patient's life, whether or not they're in your exam room or not, right? And that's what the care at VA is for veterans. We have responsibility and accountability for that veteran, regardless of whether they're enrolled with us or not, regardless of whether we're paying for their care or not. And I really do value the fact that the health system, number one, is integrated. It's not just primary care over here in behavioral health. They think of the care that they offer veterans in an integrated way, but they think of it as a lifetime commitment. They're not just here for, the time frame of their insurance coverage, for instance. And that's what we face in the rest of the traditional healthcare system. So me moving from VA to Cityblock is a pretty natural step because I look at that care model as so parallel that I learned a lot from that I'm hoping to replicate in Cityblock.
Yeah, I was just thinking, you described the mission of supporting our veterans and thank them for their service, but also, being there for them as they transition back into, civilian life and all the challenges associated with post-traumatic stress and just the social determinants of health as it relates to being a veteran. That's probably a whole nother concept around that too. How is Cityblock then taking that model and trying to incorporate what's been a pretty successful one for veterans, arguably, to applying that into the public sector now?
Yeah, so I think part of what we definitely recognize is that we need to bring down those walls, those silos of healthcare. So we need to have an integrated practice. We are integrated primary care, behavioral health, and social care. So our focus on social determinants of health is something that I take on as our chief health officer. It's not a side piece to what we're providing our members, but instead it's actually part of their healthcare, part of their care team. We have community health workers who are asking the questions, screening the members, and really understanding what their needs are, and then assisting them in actually achieving those goals. It's not just, oh, we hear you have a problem, let me refer you over there and let them figure it out, because we're healthcare and we don't do anything about it.
Right.
Right? Like that's often the case in healthcare. So we really look to integrate the work that we do. We look to, again, engage and earn their trust. And we recognize that we have to meet the member where they are. So we don't consider ourselves, a lot of newer companies coming up now, if you hear it in healthcare, they say virtual first. I actually don't like that phrase, particularly for the communities we serve, the trust that we need to earn. I need to be able to meet that member where they are on that first visit. And I don't think I'm going to do that in every case on a screen. So I'm never going to say virtual first. I'm going to meet them in their homes. I'm going to meet them on community park benches. We've got a bunch of members that's where we met them. They felt safest there. Or I'm going to bring them into our office because we have hubs in certain markets. So we are multimodality. We are integrated, and we're focused on equity. We're focused on making our workforce look like the members that we serve. And we're focused on taking care of that patient as holistically as possible.
I love it. I love it. It's, meeting them where they are, in this new hybrid delivery model for healthcare, right? It's not just about focusing on delivering care in the four walls of a clinic or a hospital, but where that patient, is in some cases most comfortable, or where you can actually get access to them. And addressing the holistic approach to their health, because it's not always just about the physical aspect of it, but it is the mental, social, economic, all those social determinants that impact their quality of life as well. And so that's an amazing thing. I commend you and your colleagues for your work there. But you're now trying to shift the paradigm, right? And how the care model is delivered. That's probably a challenge, I'm sure. What have been some of the barriers or challenges you faced in trying to establish this type of model of care, and how are you guys overcoming some of those challenges?
I think, let's see, barriers are always about access to care, right? Like when you think about a patient, I'm trying to come up with a good example. Stories are always helpful. A patient's journey is always helpful. If you think of a patient who has a really bad cough, maybe some pretty significant lung disease, they are usually referred by their primary care doc, who's maybe seeing them for these quick 15 minutes where they can't necessarily get all their concerns out, right? Because the doc is a little bit rushed. Sure. Very rushed, right? They need to get referred because of that lung disease over to a pulmonologist. Depending on what city they're in, pulmonology wait could be a month to 6 weeks.
Right.
You may also have a skin condition. Maybe the primary care doc doesn't feel that comfortable, so now you need to get referred over to dermatology. You also have a little bit of depression, a lot of depression even, and you need to talk to someone about that. And your health insurance company really isn't giving you a lot of information about how to find a behavioral health doc or counselor or anything. So you have to figure this out. You have to really traverse and make phone calls and told, oh, sure, they take new patients. You call up. They're not taking new patients. They never are. The people that they give the first phone number or two to find. So part of the difficulty that we're trying to help with is to be by the side of our patients to help them do this navigation. Medicine and healthcare, we set ourselves up into these silos because just like the concept of the specialties, the concept of how we set up the structure of healthcare is very separate. So we force our patients to fit that
to navigate
as well
that.
too.
That's
to
right.
navigate that.
Yeah.
And I get confused when I have to navigate that. Unfortunately, my mother has some illness. I'm getting confused and getting mad at people. And I'm like, and I understand this. What are my patients going through?
Absolutely. Absolutely.
So part of what we want to do is to stand by the patient's side and help navigate, help coordinate, and more than anything, be their advocate. So we want to sit in that room with them and help them understand, or help them maybe just even write down the things we need to follow up on. Because of course, if they're sitting there and they're being told information, sometimes it's hard to keep track of everything. So we want to be another voice, another advocate in the room with them, where we want to go to their home, or we want to bring them some food, or we want to talk about new medications. All of this is about really making sure we're meeting the member where they are and meeting what their needs are. And not assuming that we're going to define that, but that the member needs to help us do that.
That's right. It's about the health in healthcare, right?
Exactly.
It's about the reactive nature of it, but how do we continue to proactively offer services, solutions that improve the quality of their life? So hopefully they don't have to engage those more expensive and more intrusive parts of the delivery system as well, too, which is a huge paradigm shift because, again, many healthcare systems are building massive new facilities, offering, investing in technologies and all sorts of infrastructure in the hopes that people will have it, will need them. But in fact, the focus should be more on how do we keep them out of the hospital versus offering better solutions within those four walls.
And that's why we need transformation of the payment structure.
Right.
Because there's no real incentive in a system where payment is dispersed based on number of nights stayed in the hospital, bed stay. That means you're incentivized to fill beds, which means you are not incentivized to keep people healthy.
Exactly.
Just point blank.
Absolutely. Absolutely. We definitely have to change the business model for care. So it is still a sustainable model. I mean, it's the saying, no money, no mission.
Exactly.
Right. And so we still have to get a sustainable model for these facilities to operate, because there will be individuals who need to take advantage of the most acute parts of the delivery model. But how can you continue to do that and keep those sustainable while hopefully improving, the lives of patients, especially as those of us who are baby boomers continue to get older, and will start to tax the healthcare system even more so over the next, couple of decades. As I knew what would happen, our time is coming close to an end. And it's been an amazing discussion. And I gotta have you back on the program because there's so much more I want to talk to you about. But I want to get some of your final thoughts, around what's happening in the industry as well, and correcting their disparities caused by social determinants of health, including things like racism, really have no simple solution. It's going to require each of us to personally understand, and look at ourselves and ask ourselves about our own biased beliefs, and then and work hard to try to change them. It also is going to require policies, both at the local, state, and federal level, to be enacted to start to address these issues, and a new payment model, business model around the delivery of care, both in the public and private sector. People like yourself who are at the forefront of this are to be commended for leading the way, taking the arrows in the back, and hoping to show us a better way to deliver care to the communities that we serve. I'm just curious, from your perspective, any final thoughts about what you're doing at Cityblock Health, or your overall journey thus far, and any thoughts about your plans for the future?
Yeah, I'm just really excited to be in this exploration of transformation with Cityblock. I'm excited to be helping build out our strategy as we move forward, because of course we need to expand. There's more patients that need us, right? There's more communities where we need to be there on the ground. So I'm just excited to be part of something kind of at the ground level and really see how it can expand and how we can help more and how we can continue to be innovative with new solutions. What we have right now is by no means all that we're going to provide in the future. And I'm excited to have such a great team around me to help figure that out. I think from a broader perspective, just healthcare in the U.S., I think clearly, we're benefiting from the Medicaid extension of the Obama Act, and we're benefiting from, even as late as the kind of loan repayment work that this administration really pushed forward. I think there's more optimism that we should have in what we're trying to build together as a national community, but it only works. I'll just keep saying it over and over. It only works if we get out and vote and have the right people in there to actually get this done.
Absolutely.
So I'm just 100% focused this fall on these midterm elections. And I just hope that we recognize all of this positive energy and positive trajectory that we're on. We weren't going that positively for a few years there. We don't need to go back. Let's keep going forward. So hopefully everybody recognizes the importance of this fall's election.
Well, we're going to leave it at that. Thank you so much, Dr. Matthews, for your time today on Straight Outta Health IT. I did want to ask you, though, if folks want to learn more about Cityblock Health, how can they reach you or reach your folks to learn more about the services you offer?
You can definitely find us at cityblockhealth.com. I am Cityblock all over social media. Please follow me on LinkedIn, actually, just by my full name with my degrees. I'd like to really post a lot of educational information. So I'm always looking for new followers and everything. But I try to do a little bit of the other social media. But LinkedIn is probably one of the best ways to reach out.
Absolutely. I definitely stalk you on LinkedIn all the time as well, too. So that is absolutely the best place to reach her. Again, thank you so much. Please continue to keep challenging all of us to look in the mirror and ask ourselves, are we part of the problem? Are we leading, a transformational change in how we provide care to our fellow man and society as a whole? Dr. Matthews, thank you for your service, your commitment to our community, and I wish you much success in your current and future endeavors as well. And as always, I want to thank the listeners of Straight Outta Health IT for your continued support. And as always, let's make this episode go viral. Take care, everyone, and God bless. One love.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.